control chart. The story starts about 10 years ago, 11 years ago now, where you start seeing the beginnings of your quality control charts, which goes from, on the x-axis, from 2002 going to 2011, and on the y-axis you have the proportion of failures, which goes on this graph from 0 to 20%. The first blue dot you see there is a batch of 100 implants. And of these 100 implants, within the first year, 4 failed. As the practice continues, these data are being entered prospectively. In other words, every night they sit down and they enter the data on these implants, and if failures occur, they will be entered into the database. The next batch of 100 implants, 0 fail, again 4 fail, 5% fails, 5% fails. And once when you have a batch of implants, once you have 500 implants, you can start getting the essential characteristics of a quality control chart. You can plot your typical failure rate. This is a Nobel Biocare implant, it's a thionite surface, and the typical failure rate within the first year was 4%. The next thing you plot are the critical limits. The critical limits are those limits that if it was an industry, they would stop whatever they were producing. If this was in a medical hospital, and this was a quality control charts on MRSA infections, and their plot crosses these critical limits, they would actually close down the hospital. In other words, crossing the critical limits is really a very important event. And then you have the warning limits. The warning limits tell you there is something not going right in the practice. Something is happening which is increasing failure rates. Typically, people say you don't need to stop, but you need to start investigating as to what may be causing this increased failure.